Okay, my name is Ryan Vandrey. I'm an associate professor at the Behavioral Pharmacology Research Unit at Johns Hopkins University. I'm going to talk about substance use and how it relates to incarceration and arrest. Substance use disorders are a major public health problem. They're associated with an estimated annual cost of $400 billion in the U.S. Those costs bring in estimates of productivity or loss of productivity, crime, court and imprisonment fees, accidents and injury, and health. Roughly 1/4 of all arrests are directly associated with substance use, being arrests for possession of illicit drugs or arrest for driving under the influence of alcohol. And in addition, there are a number of indirect causes where substance abuse could be associated with use of drugs. One would be the use of committing of crimes in order to obtain drugs, or committing of crimes while directly under the influence of drugs. Arrests for possession have more than tripled over the last 30 years as well, so it seems that this is an increasing issue. Drug use can directly impair decision-making. So in terms of risk for arrest and incarceration, you have to look at the acute consequences of drugs. The acute effects can impair decision-making by increasing risky behavior. They can also impact the ability or the desire to make good decisions if someone is dependent on a drug and they engage in behaviors to get the drugs because they're undergoing withdrawal symptomatology. So then they're under a stressful consequence and they know that drug use is an answer. There's higher rates of drug use associated with mental health disorders, as well as poor populations who are dealing with stressful events in their environment. So drug use in that scenario is used as a coping mechanism to deal with problems in life or a mental health problem. And the use of drugs in concurrent mental health disorders can exacerbate symptoms of the disease, such as psychosis, and result in engaging in erratic behavior that can result in arrest and incarceration. Addiction is also another key component of this. Those who become addicted to drugs have an inability to gain control over their substance use, and it can have negative psychosocial consequences. The inability to initiate and maintain abstinence can result in risk for arrest for possession. The inability to achieve abstinence can also have a harmful effect on efforts to gain and maintain successful employment. Unemployment, as we know, can result in the engagement in criminal behavior. So the risk of addiction there is very important in terms of helping someone maintain a healthy contribution to society, to support themselves and their families, and also to maintain good personal health. A number of people who engage in substance use problems have a hard time maintaining abstinence across substances of abuse. Of those who seek treatment for help with the substance use problem, only about 1/4 of them are successful in maintaining abstinence for some sustainable period of time. And in the long term, an overwhelming majority relapse to drug use. Drug use is also primarily begun and engaged in an adolescent population. Adolescence is a critical period in terms of brain development and decision making. Again, as I mentioned before, acute use of certain drugs can escalate the likelihood of engaging in impulsive behavior in a population, adolescents, that's already prone to risky behavior and not thinking through the consequences of their actions. There are legal alternatives to the current trajectory with regards to arrests related to substance use. Drug courts are special dockets that have been implemented pretty widely in the U.S. to handle nonviolent drug offenders. And I think these are good things in terms of not incarcerating people for nonviolent offenses, for providing referrals to treatment for those who need it. But in some cases, abstinent on a drug of abuse in which a person has a difficulty abstaining is a condition of probation, and that can be difficult for that person to maintain and meet. There's also an increased need for providing resources and programs to reduce relapse among those leaving in a prison environment, and to reduce recidivism while also increasing their chances of gainful employment. Decriminalization and legalization are now also alternative legal options that are being investigated on a state-by-state or local municipality basis. The positive aspect of a decriminalization or legalization is that there's no criminal record associated with an offense. So that can have a positive effect on someone who's, again, a nonviolent offender. But in order for that to really achieve the entire intent, there needs to be law enforcement buy-in, because anytime that there are decriminalization efforts or even legalization efforts, there are always stipulations that must be met, and law enforcement, if they so choose to, can focus in on those stipulations and those exceptions and continue the arrest rate that we have currently. The other thing that's uncertain that's important to consider with regard to decriminalization and legalization is that has a potential to result in increased use and wider spread public health problems associated with substance use problems. So we have to be careful to monitor and track those types of things. So if we have, in the case of cannabis, for example, if we introduce legal cannabis, the question becomes, is that going to replace alcohol as a drug of choice for a number of people, or is it going to be used by more people and in combination with alcohol? And depending on what the answer to that is, can have a big impact on public health. So in summary, there's a strong link between substance use, arrest, and incarceration. The need for treatment to help reduce recidivism and to help people gain employment is important. And it's going to be very important to monitor and track and to use science to inform policy moving forward. Thank you.